The Affordable Care Act's fate is once again up in the air. Yesterday, a federal appeals court heard arguments in the latest case questioning the law's constitutionality. The lawsuit was brought by a group of Republican attorneys general. They argue that the individual mandate's 2017 repeal voids the Supreme Court decision that upheld the ACA in the first place.
While a decision has not yet been reached in that case, one facet of healthcare reform that both sides seem to agree on is medical spending reform. The Protecting People from Surprise Medical Bills Act targets the financial disputes between medical providers and insurance companies when they cannot agree on a price. That often leaves people stuck with thousands of dollars in surprise medical bills. Indiana Republican Congressman Dr. Larry Bucshon is a co-sponsor of the legislation, and he serves on the Energy and Commerce Committee and its subcommittee on healthcare. And he joins us now to discuss the bill and the ACA lawsuit. Welcome, sir.
Well, thank you for having me. Appreciate it.
I wanted to start with the lawsuit. The judges who heard this appeal sounded pretty skeptical about the constitutionality of the ACA. Of course, even people who are opposed to the ACA are concerned that completely tossing out the law could cause chaos in the marketplace, not to mention the millions who could lose health care coverage. What are you hoping for from the outcome of that case?
Well, first of all, I think that, when we zeroed out the penalty, the tax penalty for the individual mandate, based on what the law was upheld on, which is the ability of Congress to tax, then that comes into question of whether or not the constitutionality of the law is solid. And so I ultimately think this is going to go to the Supreme Court. I think the decision here will be something probably in favor of, scrapping the entire ACA, just like the judge in Texas did. But I do think ultimately it's going to go to the Supreme Court. I have a lot of concerns, though, about the people who currently have a health insurance based on the ACA, and I think most Republicans do. So whatever happens, we don't want millions of people to lose their health insurance. So if the Supreme Court ultimately decides the ACA is unconstitutional, Congress will need to act very quickly to make sure that no one loses their health coverage, because that's very important to me as a doctor, to make sure that people have health insurance coverage. And so nobody wants that to go away. I think people want to provide it in a different way, but that's another discussion we'll have to have.
So, Congressman, healthcare is at the top of minds of voters. It's one of the top issues in the 2020 campaign. I'm sure it's something they hear about from your constituents all the time. Now, there's a real big debate right now in this country about Medicare for all, about preserving the current infrastructure that we have on healthcare. What is your view of the Medicare for all proposal?
Well, first of all, you have to remember what the Medicare for all means, and that means a single payer. And so that means anywhere from 160 to 180 million people who have private health insurance, including union policies that have been negotiated over decades, will all go away. So that many people will lose their health insurance coverage. And, I think seniors should be concerned that a program, Medicare, which is already in some financial trouble, will be further strained, and then we'll have to find ways to control costs, and that usually means decreasing services. So I think once the American people know that Medicare for all means everyone loses their private coverage and we put seniors at risk, I don't think it'll be very popular. Now, that said, we still have 25, 30 million people who don't have health insurance coverage. And the thing I hear out there all the time is very high deductibles. People will have $5,000, $6,000 deductibles. So what I'm working on is the actual cost of the product, healthcare. Healthcare just costs too much money. And that's why the insurance is so expensive. So we need more transparency. We need the American public to be more aware of where the money's going in healthcare. And I think once they are, consumerism and the American people will help drive down the costs of the product and therefore the cost of insurance.
So tell us about the Surprise Medical Bills Act. What are you working on here?
Well, here's the thing. First, I want to define what a surprise medical bill is. If you go to the hospital to have care at an in-network hospital, your doctor's in-network, but one of the physicians that provides care, like the pathologist or the radiologist, is not in your network, and then your insurance company usually denies that payment. You may not know that for months, and all of a sudden you get a bill, and you're like, what happened here? I thought we were in network. So that's what we're trying to address. So we need to find a way to pay for that so that the consumer is not responsible for that money. And there's a couple of key points. Number one, there has to be a dispute resolution process between the provider and the insurance coverage, because if you just set a baseline rate and say we're going to pay the physician Medicare rates, for example, and the federal government mandates that, then you're going to see a race to the bottom for provider reimbursement, because there'll be discouraging factors that will make networks get smaller and encourage insurance companies to narrow their networks. So whatever we do, we have to keep the consumer out of it and make sure that they're covered. But we also have to have a process that allows an adequate payment to the provider, but a dispute resolution process that allows the provider and the plan to negotiate a fair fee.
Congressman, the president has made drug pricing control one of the priorities heading into the 2020 election. Are you satisfied with the administration's moves on this and the Secretary Azar have put in place, particularly on commercials having to include the price of a drug? Do you think that, as a physician, is that the way to tackle this problem?
Well, first of all, I think direct-to-consumer marketing is something that I don't favor in the first place. That said, I do have to agree that putting just the list price on a television ad, for example, doesn't help the consumer very much, because it's a very complicated process. I think it's a step in the right direction, but it is a very complicated process to decide what everyone actually pays for their drug. And that's part of the problem, the supply chain. So a lot of the things the administration is doing, I totally agree with. More transparency. We want the whole rebate system, the way that companies are rebated for the price based on the list price, to be changed. But I do have some concerns about providing information to the consumer, which I would call not, in my business, not risk stratified. What I mean by that is that all of the details behind why that price is there are not disclosed, and therefore the consumers may or may not pay that price, and it confuses people. But overall, yes, I like the direction the administration's going, trying to get prices down for everyone.
Congressman, I completely agree with you that direct-to-consumer advertising from these drug companies is very disturbing. All these ask your doctor about whatever. Is there any momentum in Congress for essentially banning that kind of advertising?
No, I don't think so. I mean, I've made it pretty clear to, the companies that I meet with that I don't favor direct-to-consumer marketing. I think they know that that's my view. I do think it's confusing as a provider. What happens is patients come to your office and request a specific medication that they've seen on a television ad or a radio ad, and it may not be the right medication for them. And so what happens is I think it just confuses the consumer. On the other hand, it does help for people out there to understand what is available. But in general, I think direct-to-consumer marketing of a complicated drug product for a complicated medical situation is not necessarily that helpful to the consumer. And certainly as a physician, I think you'll find